We are going to talk about the skull foramina. Foramina. This is يعني plural of foramin. foramin مفرد foramina جمع أو foramins. Anyway, if, we have to start with, we have 12 cranial nerve. First cranial nerve, which is the olfactory nerve, passing through the cribriform plate to the roof of the nose for olfaction, smell, الشم. Cranial nerve to optic nerve, which is passing through the optic canal, which is present in the lesser wing of the sphenoid bone. This is for vision, الرؤية. Cranial number 3, cranial nerve number 3, it is called oculomotor nerve. Oculomotor nerve passing through superior orbital fissure. Superior orbital fissure is the fissure between, it's within sphenoid bone, between lesser and greater wings. This cranial nerve supplying the ocular muscles, extraocular and ocular muscles. Cranial nerve number 4, this is also passing through the superior orbital fissure and supplying the superior oblique muscle of the eye. Cranial number 5, 3 branches, which is called the trigeminal, trigeminal, ophthalmic passing through superior orbital fissure, maxillary through foramen rotundum, mandibular through foramen ovale. And we will shift to the cranial nerve 6, which is abducens. This is passing through the superior orbital fissure and supplying the lateral rectus muscle of the eye. Then we go to the facial nerve, the nerve that supplies the face. This is coming through the internal acoustic meatus and leaving the skull through stylomastoid foramen, but its entrance through the internal acoustic meatus with the vestibulocochlear nerve, or vestibulocochlear nerve, or eighth cranial nerve, which is for balance and hearing, for hearing and balance, للتوازن وللسمع, while facial nerve supplying the muscles of the face. But the only facial nerve leaves the skull through stylomastoid foramen. And then we will go to the other foramen, which is the jugular foramen. Through it passing glossopharyngeal nerve, which is the 9th cranial nerve, vagus nerve, which is the 10th, accessory nerve, which is the 11th. All these passing the jugular foramen. With them is the internal jugular vein. And lastly, we have the hypoglossal canal, through it passing the hypoglossal nerve. Hypoglossal nerve. This is the picture showing the interior. Interior يعني داخلي, مو anterior. Anterior يعني أمامي. Interior داخلي. This is the picture showing all what I mentioned. That is a cribriform plate, optic canal, superior orbital fissure, and this is the foramen rotundum, foramen ovale, foramen spinosum, which is for middle meningeal artery, also showing internal acoustic meatus for the cranial nerve 7th and 8th, and showing the jugular foramen for the 9th, 10th, and 11th cranial with internal jugular, and showing the hypoglossal canal, which is for passage of hypoglossal nerve, 12th cranial nerve. And this big hole, or this foramen, is called foramen magnum. Through it passing the spinal cord, actually the brainstem connected with the spinal cord. This is foramen magnum. This is the base of the skull, showing the holes of the most important thing to know in this base of the skull regarding the foramina is you can see foramen ovale from here, For the mandibular nerve, you can see the carotid canal for internal carotid artery, and you can see jugular foramen for the 3 cranial nerve we mentioned above. We can see stylomuscular foramen for facial nerve exit from the skull. We can see hypoglossal canal from this. These are very important, and you can see foramen magnum. These are, and this is the other foramina are not so important like these, like those we mentioned. Okay, thank you.